The Foundations of Hypnotherapy. What is hypnosis and hypnotherapy? The specialists encountered difficulties in reaching a consensus regarding the definition of hypnosis. Hypnosis is not fully understood because consciousness is not understood. Hypnosis is a function of consciousness. The entry into the hypnotic state is a natural, innate property of consciousness. The British Medical Association has defined hypnosis as a transient state of altered attention. Some defined it as an altered state of consciousness, while others consider it a constructed psychological state. Psychology professor Ernst Hilgard, one of the founders of the hypnosis department at Stanford University, described hypnosis in terms of dissociation, in which a part of the mind operates independently from the rest of the consciousness. Most specialists agree that hypnosis involves avoiding the critical factor of the conscious mind, focused attention, and acceptance of suggestions. A more modern perception of hypnosis suggests that hypnosis is a natural state in which people enter automatically throughout the day, a state that is safe and has great potential for healing. It is a state of deep relaxation and focused attention, though relaxation is not necessary to induce hypnosis. Hypnosis is a soothing and pleasant experience that has the potential to induce very deep relaxation of the body and mind. The deep state of hypnosis is referred to as trance. Hypnosis can be also defined as a state of detachment or dissociation of the subconscious from the conscious mind, according to Professor Ernst Hilgard. The detachment of the subconscious from the conscious mind is responsible for the mnesic and sensory distortions, as well as the state of trance. If the induction technique includes the imagery of the golden light, the subconscious enters the superconscious state, dynamic from which amnesia may result. The detachment of the subconscious from the conscious mind and entering the superconscious state greatly contribute to the transformations and healing obtained through the use of hypnosis. Hypnosis is an excellent method by which people can access their inner potential and achieve positive transformation in their lives. Each of us utilizes various depths of hypnosis daily when we daydream, meditate, or relax, before we fall asleep, or when we wake up prior to becoming fully alert. We do it easily, automatically, without thinking about the process or realizing that we are experiencing hypnosis. In hypnosis, the subconscious mind is receptive to suggestions, the conscious mind is in a quiet state, and the physical body is relaxed. It is not mandatory for the physical body to be relaxed to enter hypnosis. Hypnosis bypasses the conscious mind, allowing direct interactions with the subconscious. It is not necessary for a person to believe in hypnosis to be hypnotized. Even though hypnosis is a natural state that we all experience every day, people who use it for personal development in and after a hypnotic state appear to have the ability to achieve remarkable things. Although hypnosis has been used for thousands of years, the term hypnosis was coined in 1841 by the Scottish physician Dr. James Braid, using the word hypnos, which means sleep. This term is not quite an accurate description of hypnosis, because in hypnosis the subject is not necessarily asleep. On the other hand, many clients have proven that even if they fall asleep during the hypnosis or hypnotherapy session, the subconscious mind is fully present, receives and acts upon suggestions. The state of hypnosis can be achieved either by oneself, and it's called self-hypnosis, or with the help of a person trained in the art of hypnosis, a hypnotherapist or hypnotist. Research has shown electrical changes in the brain during hypnosis. The brain waves become slower than the ones in the waking state. During hypnosis, the brain reaches the alpha, theta, delta, and REM states. There are varying degrees of hypnosis depth. Some people go very deep in hypnosis, while others go lightly. Most people experience a state somewhere in the middle. During hypnosis, one maintains control and awareness. Hypnosis is a safe and drug-free therapeutic approach that addresses the subconscious mind and indirectly the conscious level of thinking. The subconscious is in control of the conscious mind. Hypnotherapy is the use of positive suggestions and various techniques in hypnosis for implementing positive changes in the way a person thinks, feels, behaves, or to help in the healing process of various health conditions. According to the United States Department of Labor, hypnotherapist induces hypnotic state in client to increase motivation or alter behavior patterns through hypnosis. Consults with client to determine the nature of the problem. Prepares client to enter hypnotic states by explaining how hypnosis works and what the client will experience. Tests subjects to determine degree of physical and emotional suggestibility. Induces hypnotic techniques based on interpretations of test results and on analysis of client's problem. May train client in self-hypnosis conditioning. Hypnotherapy is the use in hypnosis of alternative techniques such as visualization, guided imagery and interactive guided imagery, progressive relaxation, positive suggestion therapy, neuro-linguistic programming techniques, age regression, age progression, parts therapy, emotional freedom technique. In addition, in spiritual hypnotherapy, the following therapies and techniques are used: past life regression therapy and analysis, which is exploration of the subconscious level of existence, and life between lives regression and exploration hypnosis, which is exploration of the superconscious level of existence, channeling the superconscious level of thinking, or the universal mind, angel therapy, and future life progression. In medical hypnotherapy, in addition to the above techniques, the following techniques are used: guided imagery and interactive guided imagery for healing, subconscious therapy for healing, cleansing and rebuilding the energy field of the body technique, achieving a state of unity in consciousness, emotional healing technique. The difference between hypnotherapy and talk therapy, psychotherapy and counseling is that hypnotherapy implements beneficial changes in the belief system at the subconscious level. Hypnotherapy is very effective because it's the approach that has access to the subconscious mind with its suppressed memories and unresolved or negatively oriented beliefs that lead to negative emotions. What is the model of the mind that we use in hypnotherapy? The model of the mind used in hypnotherapy has 3 levels of awareness. The conscious mind is the aspect of the mind that we use when we're awake. At birth, we don't have a conscious mind. It starts forming as we begin receiving information. Based on the quality of the information we receive, learn, or draw from our environment, we create 2 programs of thinking, the positively oriented and the negatively oriented programs of the conscious mind. It takes about 6 to 7 years until the conscious mind is fully formed, and it serves as our logical analytic center. It is limited to the physical reality. It is the most limited aspect of our consciousness. The subconscious mind is a higher level of awareness that coordinates activities related to the normal functioning of the physical body. At birth, our subconscious mind is already formed. It has a major role in creating our physiology and life. It is constantly present throughout our entire life, and it has 2 parts. The larger part is our inner wisdom and possesses a vaster amount of information in comparison to the information we have access at the human level, at the conscious mind level. The second part of the subconscious is a smaller part that contains fear-based beliefs and disempowering programming, which represent opportunities to identify and optimize them in order to progress and evolve as consciousness. The superconscious mind is the 3rd level of our consciousness, is the higher self, the higher consciousness level of awareness that can be accessed in very deep states of meditation or hypnosis. It is pure positive consciousness, the eternal level of consciousness. It stores all the memories of everything that consciousness has lived. The term superconscious mind was created by Plato. The cooperation of these 3 aspects of the mind ensures the normal functioning of the human being. During hypnotherapy sessions, the client's conscious mind connects with the subconscious and even with the superconscious levels of awareness. The goal of hypnotherapy is reaching a state of unity in consciousness with the superconscious level of awareness. During a hypnotherapy session, the hypnotherapist guides the client in hypnosis in a deeply relaxed state, a meditation-like state, a state of receptivity of the mind. The subconscious mind becomes accessible, opened, and receptive to positive suggestions, while the intellectual, critical, conscious mind becomes calmer, taking a less active role in the thinking process. The conscious mind enters a state of minimum functioning. The subconscious becomes dominant over the conscious mind, creating the conditions for the hypnotherapist to work directly with the hypnosis subject's subconscious mind. As the hypnotherapist speaks directly to the subconscious, new, healthier ideas and ways of thinking are accepted and adopted in a highly effective way. The hypnotherapist provides positive suggestions to optimize the disempowering, negatively oriented, fear-based and distorted belief systems that the client has in order to correct his or her behavior and the way he or she feels. The positive suggestions given by the hypnotherapist to client in hypnotic state are adopted by their subconscious, resulting in improvement of their thinking process, the way they feel and behave. Is the use of hypnosis and hypnotherapy officially recognized? Hypnosis has been officially recognized by the British Medical Association since 1955 and the American Medical Association since 1958 as a legitimate and safe approach to medical and psychological problems. The American Psychiatric Association and the National Institute of Health have also recognized hypnosis as a viable therapeutic approach to medical and psychological conditions. According to William Ray, a professor of psychology and Penn State hypnosis researcher, more than 12,000 articles on the benefits of hypnosis have been published in medical and psychological journals since 1950s. What type of health conditions and life issues can hypnotherapy be used for? Hypnotherapy can be used for weight management, obesity, anorexia, bulimia, weight loss, smoking cessation, stress management to reduce or eliminate stress, pain management, anger management, increasing the immune system's ability to fight disease, normalize blood pressure, overcoming allergies, ease or overcome the symptoms of asthma, overcoming certain cases of infertility, cancer treatment support, overcoming insomnia, nightmares, sleep paralysis, and improving the quality of sleep, overcoming fatigue, overcoming negative thinking, including associated with depression and suicidal thoughts, overcoming anxiety and panic attacks, reduce the intensity or overcoming headaches and migraines, overcoming attention deficit disorder, overcoming obsessive compulsive disorder, preparation for surgery, post-surgical recovery for speeding up healing, manage symptoms associated with HIV, relieve symptoms associated with irritable bowel syndrome, chronic fatigue syndrome, overcoming addiction, alcohol, drug, gambling, and so on. Fasten the healing of skin diseases, including warts, psoriasis, and atopic dermatitis, overcoming bed wetting, nail biting, thumb sucking, for birthing with hypnosis, for reducing or eliminating pain during childbirth and reducing labor time. Hypnosis as anesthesia for surgical procedures, control pain during dental procedures. Hypnotherapy can also be used for self-improvement or personal and spiritual development, for overcoming negative compulsive thinking, creating a cooperative relationship with the self, for improving self-love, self-confidence, self-trust, self-esteem, self-respect, self-image, for overcoming fears and phobias such as fear of flying, heights, water, spiders, fear of speaking in public, fear of insects, crowds, examinations, and so on. for overcoming stage fright, self-sabotage, clutter, procrastination, for improving concentration, memory, and creativity, for improving study habits, work habits, improving relationships, personal or professional relationships, to attract and create a wonderful romantic relationship with a great match, for time management, for attaining goals, improving job performance, sport performance, artistic performance, sales performance, and for spiritual growth, for self-discovery, discovery of the multidimensional facets of the higher self, for aligning with the higher levels of consciousness, reconnecting with the source, with divinity, for emotional healing, for channeling the higher self, the spiritual guides, or the source. What does the client feel in hypnosis? People in hypnosis may experience deep relaxation and peacefulness, pleasant sensation of well-being and inner peace. Though relaxation is not necessary to induce hypnosis. Fluttering of the eyes, rapid eye movement under the eyelids. The eye movement indicates that the client is in the REM state. The face becomes very relaxed. Focused state of concentration and heightened sensitivity, stillness of the body, sometimes discrete twitching of various parts of the body, a lightness or heaviness of limbs or of the entire body, elongation or expansion sensation, sensation of levitation, sinking, falling, floating, or flying, usually sensations of warmth, sometimes coolness, tingling sensation or sensation of pleasant energy flowing through the body, sensation of extension from the body, reduce or loss of body awareness, tears of joy, sensation of being in two places at the same time, visions of light of different colors, seeing or perceiving the way one sees or perceives in lucid dreaming, which are dreams in which one is aware that is dreaming. Some clients during hypnosis cannot move their body unless the hypnotherapist gives them the suggestions to move it. Levitations of arms is due to high vibration energy that flows through the body. How does the hypnotherapist know that the client is in hypnosis? The hypnotherapist may notice the entire body becoming very relaxed, usually loose and limp. Client's eyelids fluttering. You can even mention it to the client as being a sign of hypnosis trance. Breathing becomes irregular and calmer. Facial features become relaxed, creating the hypnotic mask. Tears, usually of joy, of self-discovery. You could ask the client to tell you how relaxed he or she is on a scale of 1 to 10, with 10 being the most relaxed. Another way would be to use hypnosis depth testing. How long does a hypnotherapy session last? The length of a hypnotherapy session is usually decided by the hypnotherapist or hypnotist. There are hypnotherapists who offer 45 minutes hypnotherapy sessions, 1 hour sessions, 90-minute sessions, 2-hour sessions, 3-hour or longer, even though hypnotherapist Dolores Cannon used to keep clients in hypnosis for 8 hours with or without interruptions. It's not recommended to keep people more than 4 hours in hypnosis. The reason is the client's safety. The length of the session can vary according to the preferences and techniques used by the hypnotherapist, the complexity of the life issues or health challenges the client addresses, and the requirements of the client. Techniques such as past life regression, therapy and analysis, life between lives regression, and techniques for healing require 90 minutes or longer. What should the client expect during a hypnotherapy session? The client should expect to feel comfortable with a hypnotherapist, to have confidence in the hypnotherapist and the methods that are being used. Hypnotherapy is considered to be a fairly short-term approach, and beneficial changes can occur in relatively few sessions. The practitioner helps clients activate their inner potential, inner mechanisms of healing, and to motivate themselves to achieve their goals. Hypnotherapists who are not licensed physicians, psychiatrists, or psychotherapists should not work on clients with mental illnesses such as epilepsy, psychosis, schizophrenia, and so on. Hypnotherapists combine hypnotic techniques with motivational techniques, life coaching, neuro-linguistic programming, guided imagery, visualization, regression and past life regression, progression and future life progression procedures. Psychotherapy or other forms of counseling may be applied during hypnotherapy sessions only by practitioners licensed in these forms of therapy. Who can be hypnotized? As long as a person is able to fall asleep at night, it is able to enter the state of hypnosis or to be guided in hypnosis. It is safe to say that everyone could be hypnotized. We all experience the state of hypnosis multiple times during the day and at night. We could say that since newborns and babies don't have a fully formed conscious mind, are most of the time in a state of hypnosis. Resisting hypnosis is not the same as not being able to be hypnotized. Anyone can resist hypnosis. People achieve different levels of hypnosis either by themselves or guided by others. The most common form of hypnosis and hypnotherapy programming in general, unfortunately not a very positive programming, is achieved through watching television. Everyone knows how to get in hypnosis. We do it automatically without realizing that we go into or through hypnosis. However, in hypnosis sessions, the person has to be willing to be hypnotized. The consent for a hypnosis session is mandatory. Also, the client's cooperation during sessions is required. All hypnosis is self-hypnosis according to Dave Ellman, one of the prominent figures in the field of hypnosis. Not everyone enters hypnosis at the same speed. In fact, there are some people who enter hypnosis in a few seconds, while others may require much longer. Some people go very deeply in hypnosis, while others go lightly, but all of them experience beneficial effects. Usually, even if people feel that they are not hypnotized, they experience the desired outcome. Basically, everyone can experience the benefits of hypnosis. Hypnotherapists help clients activate their inner potential, their inner mechanisms of healing, and become self-motivated to achieve their goals. Hypnotherapists who are not licensed as physicians, clinical psychologists, or psychotherapists should not work on patients with psychiatric diagnoses such as schizophrenia, dissociative identity disorder, and so on. What is the difference between hypnotherapy, psychotherapy, and psychiatry? Hypnotherapy greatly differs from psychotherapy and psychiatry. A psychiatrist is a medical doctor specialized in psychiatry who diagnoses and prescribes medication as a form of treatment of mental illnesses. A psychiatrist can also have training in psychotherapy and practice as a psychotherapist. Psychotherapists practice psychotherapy and deal mostly with the conscious mind. The conscious mind is more technical and requires a more technical approach. Studies show it is very time-consuming with slow recovery. Most health issues and mental illnesses start at the subconscious level. Hypnotherapy is the therapy that addresses directly the subconscious source. Hypnotherapy takes much less time than conscious therapy. This is because the subconscious mind is much more powerful than the conscious mind, and it is in control of it. What are the surveys saying about the effectiveness of hypnotherapy? A survey of psychotherapy literature by psychologist Alfred Berrios, PhD, revealed the following recovery rates. Psychoanalysis, 38% recovery after 600 sessions. Behavior therapy, 72% recovery after 22 sessions. And hypnotherapy, 93% recovery after 6 sessions. Source: American Health Magazine. At Harvard University, a study was conducted on 8 hypnotized patients by a research team that has included Stephen Gosselin, a professor of psychology at Harvard University, and Dr. David Spiegel from the Faculty of Medicine from Stanford University. Using PET scanners, this experiment has produced evidence that when a subject was hypnotized, the right hemisphere showed changes in its activity. They also observed changes in the activity of the left hemisphere. In contrast, when the experiment subjects were not hypnotized, changes in activity occurred only in the left hemisphere of the brain. According to studies conducted at the Institute of Cognitive Neuroscience, University College of London, suggestions administered in hypnosis even one time can produce similar actions at the human psyche with those resulted in a long-term conditioning. Studies show that 80% of psychological and physiological problems are stress-related, according to G.V. Sanan, MD. What are the hypnotherapy guidelines? Create a professional, comfortable, peaceful, and quiet office. As a hypnotherapist, dress and act professionally. Have a positive, confident, compassionate, non-judgmental, and empowering attitude. Acknowledge and respect clients' point of view and be sensitive to their needs. Do not patronize clients. Become a positive example for your clients. Trust yourself, your mind, and your intuition. Create boundaries. Be a tabula rasa for your clients. Do not discuss your personal issues or private life with clients. When you greet clients, act in a professional manner. Be careful with hugs and kisses. They can be interpreted as sexual behavior. When emailing to clients, use professional language. Do not use phrases such as "I miss you," "You are awesome," "Love you," hugs and kisses. Use hypnotherapy agreements and get permission for hypnosis. Inform the client about what hypnotherapy is, what techniques you use, describe hypnosis depths, how it feels in hypnosis, and what results hypnosis has. When the client asks questions about hypnosis, answer by describing results of research about the benefits of hypnosis. It is also important that the hypnotherapist maintain confidentiality about the client's experiences during sessions and not to discuss or share their experiences without client's written consent. Apply the principles you teach in your daily life. Have a healthy lifestyle, a professional, elegant attitude. Meditate or practice self-hypnosis on a daily basis. Meditate to connect with the light every night. Work on yourself to constantly progress. Who can practice hypnosis or hypnotherapy? Hypnopsychotherapy and hypnopsychoanalysis, psychotherapy or psychoanalysis conducted in a state of hypnosis, are practiced by clinical psychologists. Medical hypnotherapy is the prerogative of health professionals or alternative medical professionals. Hypnosis and hypnotherapy is the prerogative of hypnotists or hypnotherapists who use it either for personal growth, spiritual growth, or holistic healing. Thus, in the world, this kind of hypnotherapy could be practiced by any person without medical or psychology training who is a graduate of a certification course in hypnotherapy. Also, there are many doctors and psychotherapists or psychologists who choose to obtain certifications in various areas of hypnotherapy because scientific studies show its effectiveness.